We're seeing much more of the other respiratory viruses, and it's giving us much more of a headache throughout the whole healthcare system.
Montreal ERs like this one at Montreal Children's Hospital behind me are crowded with coughing children and sore throats, but COVID-19 tests are coming back negative. Although Quebec schools are dealing with a surge of COVID-19 cases due to the highly transmissible Delta variant, the culprit now seems to be respiratory syncytial virus, or RSV, which usually appears in November. 15-year-old Montrealer Baraka Mohammed contracted RSV.
It started off with a sore throat, but then I had a really bad cough. I was congested. My sinuses were hurting. I had trouble talking. I sounded sick. All my friends were like, wow, you sound really sick. And I was not well, and it lasted for a good 10 days.
Wheezing, lethargy, persistent cough, or difficulty breathing are all signs that medical treatment for RSV is needed. The least severe form leads to the sniffles, but it can also infect the small airways in the lungs and may be fatal in babies and young children. Dr. Horacio Arruda, Quebec's public health director, says RSV is becoming a problem, and the sanitary methods we've been using to prevent the spread of COVID, like hand washing and masks, could help. Experts say the virus is easily transmissible.
It's very difficult to avoid, and the best measures are, in fact, the measures that we put in place for COVID. But if we're sending kids to daycare and to school, they're going to be exposed and they're going to catch it and they're going to bring it home.
I was put on a 5-day course of antibiotics, and I feel like that helped. I also had a lot of soup. I had my vitamins. I had a lot of OJ, stuff like that.
I have a 13-year-old son and a 10-year-old daughter, so I'm very worried, especially because my 10-year-old daughter is not vaccinated. So that just, it's just scary. It's really, really scary.
A number was put in place for Montreal families to call to help them quickly obtain medical appointments for their children 0 to 16 years old who are ill but whose condition does not require a visit to the ER, hoping it helps alleviate stress on the already clogged health network.
If there's not any spaces in the next coming days, because they're all taken up by children who do need to see a doctor, well, then the problem will be, we'll return to the problem where the parents will be calling, they won't have a spot, then they'll have to come somewhere and they'll have to go to the emergency room if they don't have any other options.
When you had a sore throat, 2 years ago, I have a sore throat. Now it's your coughing sore throat, your head goes to the worst.
And I still have the slightest cough, I'll cough once a day. And even that, it's a very minor cough. And I feel very tired still. I feel like I'm severely sleep deprived. But I know that the virus definitely contributed to that.
In Montreal, Samsara Rainville, City News.